Welcome to IMCAS TV, 10 Minutes with Dr. Monheit, Dr. Cohen. We're going to be talking about new trends in toxins and what's next in toxins. A recent study conducted by the International Society of Aesthetic Plastic Surgeons revealed that Botox injections remain the top non-surgical procedure performed worldwide. Let's see if that will be changing in the near future and what the future has in store for us. I'm going to start with you, Dr. Monheit. There are 3 toxins registered in the United States and in Europe. What is the situation on either side of the Atlantic?
Well, first, I'll answer what the situation is on the other side of the lake, and that basically is Botox has been the senior, having been present since the late 1980s and registered as a cosmetic procedure since 2000. It has been the most popular procedure and the one that has really gained the status.
And you think it will remain in the future the most popular procedure?
At this moment, yes, but we have 2 more that have come in. In the last 3 years, Dysport has been a very good alternative, and people have a choice now between Dysport and Botox, whether one converts or whether new patients want it. A lot of it has to do with the consumer demand and also the consumer monitoring. The most recent is Xeomin, which has just entered the market within the last month in the United States. And this also is going to be a choice, both on a consumer basis and a physician basis.
So we have options now.
Exactly.
For the first time.
And in Europe, we have the same 3. I do believe the order is approximately the same with Botox, Dysport, and Xeomin. And on the other end of the world, there is a Korean toxin called Neuronox.
And that's going to be a major competitor with these 3 toxins, in your opinion?
Maybe.
Maybe. And
it's knocking on the door,
It's
though.
knocking on the door. And what about cryotherapy and the myoscience device, which is used for tissue remodeling? Is that a valid alternative to toxins?
Cryoablation is something that is not yet FDA approved, but we're seeing some studies regarding it. It's really being used mostly in the treatment of the forehead and the frontalis by affecting the temporal nerve. So it's actually cryoablation of that nerve. So it'll be interesting to see where that fits in, but really the neuromodulators in that specific category, Botox, Dysport, and Xeomin, remains number 1, not only from the Aesthetic Plastic Surgical Society, but from the Dermatologic Society as well, and the ASDS data.
So those 3 remain on the hit list of
Yes.
toxins.
And we ask, where would the cryotherapy be an alternative? It may be an alternative people who are phobic of toxin or phobic of needles, because it offers possibly that advantage. But again, as Dr. Cohen has said, it is still in a developmental stage.
Yes, a layman doesn't use toxins. It has a very negative connotation when you say toxins.
That's why we don't use that terminology with patients, and we say neuromodulators.
There you go. There you go. The other question is I have is in terms of the dosage. Is it the nuances that make the difference, and has the scientific data helped you decide which dosage for which patient, what to treat with how much?
Yeah. Well, first of all, each of these toxins has an individual unit, and one must learn how to use those units. But I think the major advance we have is the fact that we now can individualize the dosage as to what the patient's needs are. Some muscles are bigger, men need more, people more expressionistic, and many of those don't want the full look of paralysis.
Right.
Rather, they want a relaxed look.
A natural look.
So we now know how to dose according to what patients' needs are.
And we really treat different muscle groups differently. First of all, we dose on the muscular prominence, but second of all, in the areas like the glabella and between the eyebrows, we're really trying to knock out that musculature and prevent people from that appearance of frowning. In the forehead, we really want to treat them lightly, have them look natural, and avoid repositioning the eyebrows. So really, if you understand how to use one in a specific region, doesn't necessarily mean you're going to have great results in another region. And there are consensus statements out there that continue to get revised and updated based on really our experience.
Yeah. Yeah, and you have to keep up with that constantly, I assume. Now,
We've also learned the anatomy much better before and know where to distribute the toxin along muscle neuro end plates to
Right.
get better results.
right. Now, combination therapy seems to be the name of the game this year. Can you confirm that that's really the future of your industry? And is it giving you longer lasting results?
Well, first of all, combination therapy allows us to use the amount necessary to get our result of both toxins, fillers, and also resurfacing. And each of them provides a different approach of facial rejuvenation that's needed. If you try to do everything with one tool, then you're going to overdo it.
Right.
A well-trained technician needs more than a hammer. He needs other devices. And with fillers, toxins, and resurfacing devices, we then can use just the amount we need and individualize the treatment for each
In
patient.
the places that need to be treated.
Right.
And we're learning just how synergistic these treatments are, not just using botulinum protein agents to immobilize certain areas before resurfacing of the eyes, but we also use it before doing large surgical skin cancer procedures. In the forehead, for instance, there's good data from the Mayo Clinic and Tim Flynn's study. We use neuromodulators in the lower face prior to using fillers, and Gary and the Carruthers did a very nice article in Dermatologic Surgery showing the combination has higher patient satisfaction and looks better to physicians as well. So I think we're really just exploring the options that we have out there. We're even doing combination therapy of different types of lasers together at the same session. So,
And are there new ways of delivering these toxins?
in the States, cannulas are becoming bigger, and I think
Cannulas, yeah.
many of us
Fillers.
learned cannulas here. You know, so we have different ways to deliver these, different needles for neuromodulators as well.
Now, it's interesting you say in Europe, FDA approval, you are under FDA approval. Are there things that exist in Europe, toxins that exist in Europe or elsewhere in the world that they have that the United States doesn't have?
Yes, there are.
And not just products, but dosages.
Well, first of all, there are products scattered around the world that the FDA hasn't approved of. There are also knock-up products that we don't want to see come in. Some of them have no toxin, some of them have too much toxin. The FDA is not a bad thing.
No.
The FDA has allowed us to really use safe medications and safe fillers.
Which is the most important thing.
Now, what's amazing is the filler world, with over 1,000 fillers scattered around the world. Some of them are just a blip on the radar screen that appear today and are gone tomorrow. Some of them are the next new great event that'll come to the U.S., and that's what IMCAS is so great about, because we can see them all. Some we don't want to ever see, and some we want in our compendium in the next few years.
We really do look to the European experience in using these because these agents become available many years before they do in the States. So looking at the European experience, speaking to the physicians at these types of meetings, listening to the key opinion leaders from Europe, and then seeing the data that comes out of Europe leads to excitement in the States about what we're going to have on the horizon.
I have time for one more question, but an important one. Toxins are not just treating wrinkles anymore. They're also restructuring the face. Are you seeing more of this?
Yes, we are. We can raise the eyebrows. We can change and open the eyes. We can decrease the wide width of the lower face by injecting the masseter muscle.
So it's having a reconstructive and aesthetic use now.
So
Exactly.
reshaping the face for masseter hypertrophy has become a very big treatment. We have patients that are grinders, patients that just look like they have a square jaw, that want a more feminine jaw, and it's a very exciting area. We actually even see preliminary studies about contouring different muscles. The gastrocnemius muscle is the back of the calf area. People call it radish calves when somebody has a really prominent calf area, and botulinum toxin agents have been effective for that as well.
Well, thank you very much. Your expertise has been invaluable today. Thank you for joining us.
Thank you.
Our pleasure.